Healthcare. How can I help you? Certainly. Tomorrow afternoon at 3? Okay, thank you. Bye.
One path a patient dealing with cancer can take is radiotherapy, a treatment pathway that involves a wide range of staff, each with a different role that benefits the patient. Before their radiotherapy treatment, a patient will go for a CT simulation to assess their tumour and enable a treatment plan to be prepared. And then, every day, they will come for treatment on a linear accelerator which uses radiation to kill the malignant cells and try to shrink the tumour or remove any last malignant cells that may have been left after surgery. This process is carried out by a patient's radiotherapist on that particular machine or unit. This term includes a wide range of staff, including senior, junior and student radiotherapists, who will bring in a patient, make sure they are in the correct position, and then deliver the treatment by controlling the machine and following the plan for that patient. This plan was created by planning radiotherapists using the CT scan taken prior to treatment. There are also staff in the mould room should a patient require extra equipment for their specific treatment, such as a mask to ensure they remain as still as possible. There are also many other professionals a patient will meet during this path, such as their consultant, who would have sent the patient for diagnosis and then recommended radiotherapy as a viable treatment, radiographers, who would diagnose the patient using CT or MRI scanners, receptionists, who would see a patient every day, booking them in for treatments, transport, who may be required if a patient cannot get themselves into the department every day. They may also meet staff who are there should the patient need support, such as Macmillan staff, who can offer information and guidance to patients about a wide variety of issues. And let's not forget the staff who work in the background, the physicists who check the plans prior to treatment and ensure the linear accelerators are working correctly, as well as the cleaners who ensure the department is a safe environment for staff as well as patients. There are also many more professionals involved in a patient's treatment which have not been included, but nonetheless have an important role to play.
Occupational therapists are one of the many health professionals in oncology, which means cancer care. They have a role to play at all stages in the cancer pathway, such as in people's homes, in the hospital, in the community, in nursing and residential homes, and in daycare and inpatient hospices. And like other rehabilitation professionals, the occupational therapist's aim is to improve the quality of life so that people's lives will be as comfortable and productive as possible, and that they can live as independently as possible, and they're able to rapidly respond to any changing needs. So if you're having difficulties in coping with everyday activities, here are just some of the things that occupational therapists can help you with. In the area of self-care, they can work with the person and within the person's functional abilities to practice and adapt in areas of self-care such as washing and dressing, and they also can help in areas of work and leisure activities. For fatigue management, they can work with people to identify their goals and priorities, and they can advise and educate the person regarding pacing, planning, balancing and prioritising activities, and they can provide strategies to manage their fatigue and to conserve energy. For stress management, they can work with people with cancer and their families and friends to achieve balance in life, and they can teach relaxation techniques.
My name's Wendy Wilkinson. I'm a Macmillan occupational therapist working in cancer rehabilitation, and I'm based at Singleton Hospital in Swansea. I meet people undergoing various different types of treatments, and all of these have impacts on those individuals in physical, psychological and social ways. My role in this is to establish ways that they can improve their daily activities. I can provide counselling and cognitive therapies for people who need support with their emotional challenges. I can provide physical interventions, especially here in the hydrotherapy pool, where some people come in to have pain relief, to get stronger, and other people come in for breathlessness management. Because I ask people to set their own goals, the type of rehabilitation that we might do is very different for each individual. For some people, we might be practicing kitchen activities because they want to become independent with cooking. For other people, it's more meaningful to get back out into the garden and tend their veggie patch. I help people to become independent with whatever it is that makes their life meaningful. If somebody who was affected by cancer was nervous about engaging in cancer rehabilitation, I would encourage them to try one of the sessions at least once. It's rare that after having met other people who are going through the same process, that people don't want to join in. Sometimes I identify needs that I can't address. Now I work as part of a wider Macmillan team, and it's great because I can actually refer directly to my colleagues to make sure that that person has their needs met.
Karen, the dietitian here, helped me out a lot, particularly because early on, in being a digestive type cancer that I had, many foods weren't working well or sitting well. So we worked with Karen and she helped me out. She gave me a lot of good tips, gave me a book that I could take home and look at. That would also help my wife shop. But then as we progressed, I didn't have to stay on that diet so much. But we got the book at home, you know, eating for cancer, eating with cancer and stuff like that. And good tips in there, real good tips.